Medicine certainly has come a long way. Medical procedures that may have seemed impossible 100 years ago are now almost routine. Heart and liver transplants, vaccines against polio and the flu. But there always had to be a first time, a brave pioneer willing to attempt to expand medical knowledge, and a patient willing to be the first. And so it was on February 15th, 1921, in New York City at the Kane Summit Hospital. A doctor is performing a very unusual appendectomy. In many ways, the events leading up to the surgery are uneventful. The patient has complained of severe abdominal pain. The diagnosis is clear: an inflamed appendix. Dr. Evan O'Neill Kane is performing the surgery. In his distinguished 37-year medical career, he has performed nearly 4,000 appendectomies. So this surgery will be uneventful in all ways except two. The first novelty of this operation will be the use of local anesthesia in a major surgery. Dr. Kane is a crusader against the hazards of general anesthesia. He contends that a local application is far safer. Many of his colleagues agree with him in principle, but in order for them to agree in practice, they want to see the theory actually applied. Dr. Kane searches for a volunteer, a patient who is willing to undergo surgery while under local anesthesia. A volunteer cannot easily be found. Many patients are squeamish at the thought of being fully awake during their own surgery. Others are fearful that the anesthesia may wear off too soon before the surgery is completed. Eventually, however, Dr. Kane does find a candidate. And so, on that Tuesday morning, February 15th, more than 100 years ago, the historic operation takes place. The patient is prepared and wheeled into the operating room. A local anesthesia is applied. As he has done thousands of times before, Dr. Kane dissects the superficial tissues and locates the appendix. He skillfully excises it and concludes the surgery. During the procedure, the patient complains of only minor discomfort. The volunteer is taken into post-op and then later placed in a hospital ward. He recovers quickly and is dismissed 2 days later. Dr. Kane had proven his theory. Thanks to the willingness of a brave volunteer, Dr. Kane was able to demonstrate that the local anesthesia was a viable and even preferable alternative. But I said there were two facts that made this surgery unique. The first was the use of local anesthesia. The second was the patient, the courageous candidate for surgery by Dr. Kane was Dr. Kane. To prove his point, Dr. Kane operated on himself. The doctor became a patient in order to convince the other patients to trust the doctors. But Dr. Kane wouldn't be the last doctor to scoop out his own appendix. In 1961, Leonid Rokonoff, the sole physician at the Soviet Union's Antarctic Research Station, performed an emergency self-appendectomy with the station's meteorologist and mechanic as his two assistants. And more recently, and more incredibly, Beirut surgeon Dr. Ira Khan allegedly removed his appendix himself in 1986. However, unlike Dr. Kane, Dr. Khan didn't put himself under the knife for the sake of a medical experience or experiment. As the story goes, he was stuck in traffic and unable to make it to the hospital. And so he performed the surgery on himself from the comfort of his car. Really cool. Yes, doctors are amazing. But let's not make Dr. Khan's experience become a new routine. I'm Larry Johnson. Until next month, stay well.